Hello everyone. Today we'll be discussing about a topic that lot of people are worried about, especially after a hair transplant procedure, that is sock loss. Let's discuss in details what is sock loss, what's the cause behind sock loss and how to prevent it. Sock loss is basically a phenomena where your existing hair especially in the recipient zone undergo transient thinning or loss, leading to reduction in the density in the recipient area. Before discussing in details about this sock loss, let's have an insight about a hair cycle. Our hair remain in three different stages. First is the anagen, that is the active growth phase, then the transition, that is the catagen phase, and finally the shedding known as the telogen phase. Any form of insult, either physical, mechanical or psychological, can affect hair loss. If your hair is already thinning, then the possibility of hair loss is much more and can be more intense. Similarly, hair transplant is a state of insult to the scalp. During this process, what happens? We are extracting hair from the back of your scalp and putting into the front. During the process, the recipient area, the existing hair, getting subjected to the process of incision, injection of anesthesia, anesthetic fluid, and also during the implantation. So some amount of vascularity compromise or some amount of blood flow compromise may happen, and as a response to this, the existing hair in the recipient area gets stressed out. That lead to this sock loss. Sock loss is more common in the person those who have a good amount of existing hair in the recipient area. It is more common in female where you do transplant in between the existing hair, that's known as the non-trimming or non-shape method. But good point is sock loss is a completely reversible phenomenon. So how to prevent it and what is the way to get rid of the sock loss or to have an early recovery from the sock loss? As we discussed, sock loss is a transient phenomena, but there are certain remedies that will help have a early recovery. First and most important is to have a good diet. Improve your nutrition post transplant. Focus on good protein diet that help in providing better nutrition to your existing hair. Other point is, if you are already suffering from hair loss, your existing hair also thin, weak, you can consider taking oral finasteride or dutasteride. That really helps in early recovery from the sock loss. Minoxidil, which is a solution known as a vasodilator, also improves the blood flow to the recipient area. That really also helps in early recovery for this sock loss. In our practice, we used to inject PRP, that is a platelet-rich plasma therapy, before during the implantation. What we have observed in a person having good amount of existing hair, so this PRP injection before surgery really helps in minimizing the sock loss. Similarly, the sock loss can also happen over the donor area, but it is not that common. It may happen especially if the surgery being done not by an expert. Over extraction of the graft from the donor area, too much use of adrenaline during the anesthesia, or use of large sponge can damage the vascularity. That can lead to sock loss in the donor area. More or less it is reversible, but if too much extraction has been done from the donor area or closely over extraction done from a single area, sometimes the sock loss in the donor area may be irreversible. So in summary, sock loss is a common phenomena that more so happen in a recipient area. So if you are having sock loss and if you feel like you are losing hair post transplant, and that too in the non-transplanted hair, that means you may be suffering from sock loss. So whatever steps I have suggested, you can follow that. Still, if you feel like it's not improving, it's not to get worried, because it is a completely reversible phenomena. Consult your hair transplant surgeon, take the medicines and follow the advice. Definitely you will get rid of this thing, and with time Eventually the transplanted hair will grow after attaining the shedding phase, and all the non-transplanted hair that you feel like you are getting lost because of this shock loss, also you will get back, and ultimately you will enjoy head full of hair. Thank you.